top 5 serial killer that were actual physicians. A physician is a person who is trained in the art of healing. Unfortunately, these 5 medical doctors preferred to apply their training and skills to the art of killing, again and again. Here's a look at some of the most vicious serial killer doctors in history. Please subscribe, thank you. 5. H. H. Holmes, cadaver collector and thief. Herman Webster Mudgett changed his name to Henry Howard Holmes, aka H. H. Holmes, after graduating high school. Holmes resumed scamming insurance companies before being arrested again. This time, the police raided the castle and discovered many bodies and partial bodies. He was eventually convicted of murdering the children of an acquaintance and confessed to another 28 murders. Investigators believed, however, that Holmes was responsible for as many as 200 murders. Considered one of America's first serial killers, he was hanged in 1896. 4. John Bodkin Adams, Angel of Death or Angel of Mercy? Before Harold Shipman, there was John Bodkin Adams. Between 1946 and 1956, more than 160 patients of the British doctor died of suspicious deaths. And 132 of these patients put Adams in their wills before they passed away. In 1957, Adams was tried for the murder of one of those patients. Newspaper headlines read, "Murder Trial of the Century." Inquiry into 40 wills, and Murder Trial of the Century. The doctor was accused of targeting elderly female patients, changing their wills, cutting them off from their families, and killing them with lethal injections of morphine and heroin. In the end, he was found not guilty of murder. A later trial, however, found him guilty of 13 offenses, including prescription fraud, lying on cremation forms, obstructing a police search, and failing to keep a register of dangerous drugs. Bodkin was stripped of his medical license, but it was reinstated in 1961. He continued practicing medicine until 1983 when he died of natural causes. 3. Leonardo Cazzaniga, Italy's diabolical lover doctor. In April 2021, a Milan court upheld the prison sentences of a convicted emergency room doctor and his nurse lover. Leonardo Cazzaniga, 65, was convicted of killing 10 people, and acquitted of 3 other murders and sentenced to life in prison. His mistress, Laura Tironi, was sentenced to 30 years for murdering 2 members of her family. Dubbed the diabolical lovers by the Italian press, the lovers have been incarcerated since 2016. Cazzaniga was found guilty of the voluntary manslaughter of 8 patients in the Saronno hospital. Prosecutors said the doctor killed in a delirium of omnipotence by administering overdoses of anesthetic and sedative drugs to his patients. Police had investigated 40 deaths between 2011 and 2014 that aligned with Cazzaniga's work shift. One of the patients was Cazzaniga's own father. Defense attorneys argued that the practices were consistent with standard palliative care. But the prosecution pointed out that one of the victims had died after being admitted with nothing more than a dislocated shoulder. The doctor was also convicted of killing his nurse lover's father-in-law and acting in conjunction with her to kill her husband. Tironi, a 44-year-old mother of 2, was found guilty of murdering her husband and her own mother. Diabolical lovers, she said in a police wiretap. Tironi convinced her husband that he had diabetes and administered lethal doses of insulin to him. Further appeals by the couple are anticipated. 2. Shiro Ishii, germ warfare enthusiast. During World War II, the United States and Great Britain tested biological weapons on animal subjects. But Japanese medical officer Shiro Ishii was not restrained by ethics. He used humans to test some of nature's deadliest pathogens. Ishii became a doctor in 1920 and, in 1921, was commissioned into the Imperial Japanese Army as a military surgeon. When the 1925 Geneva Protocol banned the use of biological and chemical weapons in war, Ishii urged the Japanese Army to develop them. He traveled through the US and Europe to research the biological and chemical warfare developments that followed World War I. In 1936, Ishii was given formal control over Unit 731 in China. The unit was intended for research that would benefit Japanese soldiers, such as learning how the human body withstands hunger and thirst and fights disease. Early experiments were conducted on consenting volunteers, but the methods changed under Ishii's purview. A doctor's God-given mission was to block and treat disease, he said, but the work he took on was God-given mission in this research facility. Ishii and his men performed experiments on live humans. Chinese prisoners and Allied POWs were used as guinea pigs, forced to breathe, eat, and receive injections of deadly pathogens: anthrax, gas gangrene, smallpox, typhoid, cholera, plague, botulism, and dysentery bacteria among them. The researchers induced frostbite and pregnancies and conducted vivisections without anesthesia. It is estimated that more than 10,000 died during these experiments. When the war ended, Ishii faked his own death and went into hiding. He was found by American forces and offered to reveal the results of his program in exchange for immunity from war crimes prosecution. The Americans accepted the offer but found little of value among Ishii's records. Biological weapons were not mentioned in the Japanese war crimes trials, and Ishii died a free man in 1959. 1. Joseph Mengele, twins-obsessed Nazi physician. Before he became a Nazi physician, Joseph Mengele, with doctoral degrees in physical anthropology and genetic medicine, worked as a legitimate research assistant studying twins at the Institute for Hereditary Biology and Racial Hygiene. But Mengele fully embraced the nationalist, racist, and anti-Semitic views of the Nazi Party and aimed to utilize his skills and training to that end. Mengele joined the Nazi Party in 1937 and earned his medical degree in 1938. In 1940, he was drafted into the army, where he volunteered for the medical services of the armed SS. By the end of 1943, SS Captain Mengele became the chief camp physician at Auschwitz II, Birkenau. He and about 30 other physicians made regular selection rounds on the ramp to determine which incoming prisoners would be retained for work and which would immediately perish in the gas chambers. Mengele's brutal demeanor in this role earned him the title Angel of Death. Mengele even appeared in the selection area while off duty, always searching for twins and individuals with remarkable physical attributes, dwarfism, heterochromia, to use for medical research. He was free to conduct research as he desired, performing agonizing and often lethal experiments with Jewish and Roma, Gypsy, twins, most of them children. About 3,000 twins, most of them children, Mengele's children, were pulled from the ramp. They endured daily blood draws and mass transfusions. Mengele injected harmful chemicals into their eyes to fabricate blue eye color. He would inject one twin with diseases and kill the other to perform side-by-side post-mortem examinations. Mengele administered spinal taps, castration, organ removal, and amputation without anesthesia. Only about 200 of these twins survived. Mengele was never arrested for his war crimes. He fled and evaded capture for the next 34 years. In 1985, German police located his grave in South America and exhumed his corpse. 10 dishonorable mentions: Jayant Patel and Michael Swango. Thanks for watching.